I'm Sally Sykes. I'm from the Houston area, Houston, Texas. I'm 68 years old, married for 46 years to a great man, have 3 grown children and 10 grandchildren. I was a school teacher at one time. I taught phys ed and physiology. I have been in the real estate business. I owned a business. Work for a state senator right now. I sing in a barbershop group. I play golf. And I'm the first person to receive the matrix coil in the United States.
Oui, Jean, ça va? Tu vas bien? Oui, oui, ça va, et toi? The matrix coil was actually developed by a group of scientists and physicians at UCLA. And what it really consists of is a platinum coil with a special coating over the platinum coil. And the coating is actually made out of a polymer that has been used in the past in humans and is very well accepted by the human body.
I was having some distorted vision. I would have maybe 15 or 20 minutes of vision that was not normal as far as I'm concerned. And so when it occurred one time on the interstate, I decided that maybe I needed to check it out. It's kind of a scary place to be when you don't see real well going 70 miles an hour. I made an appointment with the ophthalmologist. I wear glasses, and that was the logical place to go to make sure that I didn't have a retina problem or some other eye condition taking place. And after a thorough examination, he said my eyes were healthy, that I had the symptoms of a migraine without the pain. And he told me then that if they got worse or occurred more frequently, lasted longer, these little episodes, that he thought I should see a neurologist, which I did.
Her workup included an MRI, an MRA of the brain, which made the diagnosis of the aneurysm located at the tip of the basilar artery. This is a fairly serious condition that carries the risk of catastrophic bleeding in the head, which may lead to either death or catastrophic stroke or significant neurological impairment.
It's kind of a rude awakening that you're dealing with something that's kind of unknown, and from our standpoint, we kind of felt like it was like a time bomb that could sit there and never go off, or it could go off instantly. So it was, hoping that we could find somebody that could help us deal with it.
The surgery for Ms. Sykes would have been an option, although it would carry morbidity and some mortality with it, and it would involve major retraction on the brain, and it's really a big surgical open operation.
That was an option, but not really, because nobody wanted to do it. But our neurosurgeon suggested that we see Dr. Mawa, who does this procedure, and felt like I was a candidate for it. So that was very hopeful for us, and kind of scary as well, because we didn't know him and we didn't know anything about this procedure, which of course we soon learned.
And in essence, what we do with the endovascular treatment is, under general anesthesia, we approach the femoral artery through a puncture, and from the femoral artery we navigate through the aorta and through the basilar artery, a tiny microcatheter. We position the microcatheter inside the aneurysm, and we slowly deploy these coils one at a time.
It just impacts you as being considerably less threatening than having someone take a knife and, cut your head half open. So I was comfortable with that. I was kind of excited about the fact that I was getting an opportunity to have something, the newest and the best, and having the best do it.
And this is really how we treat aneurysm. We always do a 3D, yeah.
1 week after I got out of the hospital, we took a golfing vacation and I played 7 days in a row. Because my life is just as normal and as active as it ever was. I don't think I've skipped a beat other than maybe about 3 or 4 days.
It's close.
Among the physicians who work in this field, Boston Scientific has a pristine reputation. It's really the premier company to work with, in my opinion, because of their integrity, because of their commitment. They have been committed to this from day one, and they were the pioneers in this field.
I feel very fortunate that I was in the right place at the right time and saw the right physicians to tell me that I had the option to have a coil, the coiling procedure done. I truly am blessed, and I do feel like I'm a miracle child or a walking miracle or whatever you want, a miracle old lady, whatever. But it's pretty incredible stuff.
Boston Scientific, in my own judgment and with my own experience, having worked with them for over 10 years now, probably longer than that, I want them to know, each and every one of them, that everything they do that may seem a routine job for them is actually, at the end of the day, helping us treat patients better, helping us make life better for human beings who one day could be you or me or one of them, laying on a table with an aneurysm and hoping that somebody is designing the proper coil, the proper device, the proper stent, and hoping that all of us working together can improve the technology and can improve the quality of life for each and every patient we see. These are human beings we're dealing with, and Boston Scientific is part and parcel of improving their life.
Well, I can't think of a better thing to say than thank you very much. I mean, you've saved my life, and I know you've saved many others and will save many others. It's what you do is very important. You know, I don't want to get teary-eyed, but when I think of, you know, my job and maybe how I affect people, sometimes I don't realize the contribution I make. And perhaps you don't either, but you have made an incredible contribution to my life. And I will be eternally grateful for every one of you. So thank you.